Sepsis is one of the most serious conditions in modern medicine. Every year, it affects nearly 50 million people and claims 11 million lives. Today we are going to talk about a controversial treatment, corticosteroids. When we talk about sepsis, we are talking about a complex problem. Usual treatment includes antibiotics, intravenous fluids, and life support as needed. However, corticosteroids have been studied as a possible complementary therapy. Why does its use continue to generate so much debate? The answer is not simple. On the one hand, they may offer benefits such as stabilizing blood pressure and reducing inflammation. On the other hand, they can bring serious risks such as muscle weakness, secondary infections, and even metabolic complications. To understand this dilemma, we must turn to the guides. The most influential is the Surviving Sepsis Campaign Guidelines, also known as SSC. These international guides are a reference both in Europe and in the United States. And what do they tell us about corticosteroids? The current recommendation is weak. This means that its use depends somewhat on the clinical context. It is neither mandatory nor completely ruled out. In cases of septic shock that does not respond to other treatments, corticosteroids may be useful. However, the 2021 guidelines reflect an important shift. Previously, the position was more restrictive. It is now recognized that corticosteroids may slightly reduce mortality. This potential benefit comes with an increased risk of adverse effects. What is happening only in Europe? In Europe, the guidelines of the European Sepsis Alliance complement those of the SSC. The emphasis here is on promptly starting antibiotics and appropriately administering intravenous fluids. However, they do not comment directly on the use of corticosteroids. But, in the United States, yes, they are considered in specific situations. For example, acute respiratory distress syndrome or community-acquired pneumonia. Methylprednisolone is recommended in certain cases of severe respiratory distress, provided it is administered early, within the first 72 hours. And what about the doses? For patients in septic shock who do not respond to other treatments, guidelines suggest intravenous hydrocortisone. The usual dose ranges between 200 and 300 milligrams per day. This is administered as a continuous infusion or in bolus every 6 hours. Treatment usually lasts between 7 and 14 days, depending on the patient's response. Then it is time to individualize in each case. I'll leave you the links to the most recent guides in the description. Yes, I have answered your question. Don't forget to give it a like and subscribe so you don't miss any video. Your help allows us to reach more people. If you have any questions or would like to make a query, you can leave a comment and we will gladly respond. Thank you for your attention and see you next time.